Today I'm going to talk about the Starburst bevel. What is the Starburst bevel? The Starburst bevel was suggested by Leanne Brady for class 4 restorations for aesthetic reasons. For example, you have a central incisor, okay, or lateral incisor, and you have a class 4 fracture. We conventionally do a bevel above the fracture line by 1.5 to 2 millimeters. We extend it 1.5 to 2 millimeters above the fracture line. Okay, this 1.5 to 2 millimeters bevel, okay, to gain our bonding and to have a smooth transition between the composite and the tooth. But the problem with this bevel is sometimes there is a visible line between the composite and tooth interface, so you don't have a smooth transition. Leanne suggests that if you do the Starburst bevel, you will not have that problem, or that problem decreases. What is the Starburst bevel? The Starburst bevel suggests that on this bevel you should do small bevels. For example, this is your burr and this is the tooth structure. You create grooves like the depth grooves randomly on this area, like this. I don't have a tooth, that's the problem, and we are during quarantine, so we can't actually demonstrate it on a tooth, so we're demonstrating it on the paper. For example, you do random grooves on the bevel that are different in length, size, and depth. But remember, don't penetrate through the enamel, and you should not reach the dentin, because you lose your enamel bonding, which is the most important bonding. So this bevel suggests that you will have less visible line between the composite and the tooth when you do this. Then you do your layering above this bevel and continue. There are actually, you can read on the Starburst bevel, just Google it, and there are cases that were filled or restored using this technique. There is a difference, not a huge difference actually, but there's a difference. So you can Google it and you can check it for yourself. And hopefully after the quarantine we will also demonstrate it on a tooth or on a model, so you can visualize it better.